So today, this is our discussion on the sticker on the sticker on the screen, right? The discussion tonight is we want to look at when semen is normal but weak. What does that even mean, right? Remember, it is everything fertility. So we're going to be looking at all the details. Thank you for sharing in the green app, Lady G. Thank you very much. So thank you very much. So so we're going to look at when semen test is normal, right, but weak. When it's normal but weak, that's what we're going to be looking at, right? And matter what's the matter? What is the matter? Matter, what is the matter? Maybe let me give you your own. So I think we have balanced the equation now, right? All right. If you are just joining, you're welcome. Good evening. Okay. Okay. It's all right. So I will attend to uh, matters outside TikTok shortly. All right. So if you're just joining, you're welcome. The network is going to be good today. But if you have missed anything at all, go to YouTube, search my name, Dr. Godwin EMB. All the live stream you've missed, they're already there, right? You want to give attention to them, watch them. The details are so much. Matter you don't want, you must want. I've already given it, so you cannot even reject it. Just collect it. Just enjoy the one you have now because you don't know where another one will come, right? All right. But don't forget, join the TTC League. If you are trying to conceive, you got to join the TTC League. You'll be amazed. You'll be amazed. All right. So in a few minutes we'll begin the discussion. We're talking about when semen is normal but weak. That is the details we want to share tonight. And I can guarantee you're going to learn some things tonight. It may not be that long episode, but you're going to learn some things tonight. So just make sure you position yourself for learning. If you're just joining, you're not following me, you want to follow me now because you may not find me again, right? All right, so let's begin our discussion. Who is ready for tonight's discussion? When semen is normal but weak. When semen is normal but weak. That is the discussion tonight, right? Because sometimes people can go to the clinic, right? And they'll do semen analysis with the report in their hand. They really don't even know what they're looking at, right? And unfortunately, sometimes even when the caregiver explains, you're even still more confused, right? So this episode is just to help you, give you an idea, right? Is that how Akua Otiwa? Is that you? Confirm that you are here. All right, so let's begin. Excuse me. Let's begin. Now, I said you finally get the semen analysis results. Good. All right, Hawa Akua Otiwa is here. Good to see you. You're welcome. So you finally get the semen analysis result, right? And what is written there is all the values are within normal reference range. Nothing can be so relieving like that kind of result. You say, oh, hallelujah, thank God. Right? Thank God. You feel relief. Say, hey, now we can go and knock what's no good and get result, right? So what happens after then? Because you go back now, you go and become more determined, but months later, there's still no pregnancy. Why? Why is it so? Why is there no pregnancy? Right? So what happened? But the result said it's normal. So why is it not? Why are we still not pregnant? How can semen be normal and yet conception does not occur? Think about it. How can semen be normal and conception does not occur? So this question forms majority of what we're going to be answering tonight, right? We're going to address this mostly misunderstood reality in fertility medicine, right? Because, from what we've said a few days ago, normal does not always mean optimal. That all the values are within normal range does not mean optimal. And all those reference range does not equal to high quality potential. Now you already know what quality sperm is. Quality sperm is not what you see with your eye. It's not what they wrote on the paper. Quality sperm are those things that cannot even be measured. Right? So let's begin to unpack this mystery. Is that Adelaja? I thought I saw Adelaja. If it's you, confirm it's you. Good evening, you're welcome. Right? So let's unpack this gist carefully. Why am I looking? What's happening? All right. So let's look at it from practical standpoint. So what is the problem with that word, normal? Good evening, Adelaja is here. Good evening, you are welcome. Right? So the problem with normal, that the word normal, when you do semen analysis, the problem is that labs would use reference range that is established through, those ranges are from studies, scientific studies, right? From certain population studies, and these forms what you consider to be a statistical threshold, but they don't guarantee reproductive success, right? That your results fall within the range is still not a guarantee that the moment you leave the lab, you are going to become pregnant. You did abortion, but now you feel bleed for only. I don't understand what you are saying, and I don't want to hear the word abortion. My job is to make people pregnant, not to talk to people who are aborting. We want the babies, don't abort them. Right? So I don't know why you're aborting. Was your life in danger? Unless your life is in danger, you should not be talking about abortion. But I need to understand what you're saying. Dija Bubari is here. Right? So, where was I? Thank you for the follow, Dija. I see you. So, let's look at borderline normal. What does that mean? That quiet gray zone. What the borderline normal will look like. Let's look at maybe one or two examples. Now, you have sperm concentration of 16 and the reference range is 15. Right? What does that mean? That is borderline. But technically speaking, it is normal sperm results, right? Normal test results, technically, where the sperm concentration is 16, the reference range of lower limit is 15. That's a normal result, right? But when you compare it to someone with 60 million per mils, the probability for the 60 million individual will be different for the probability of the person in the 15 million. Is this clear? Is this clear, or I should go back again? Who is still here? Did you understand anything, or I should go back again? I'm talking about borderline. When you get your result and they show you borderline normal, what does that even mean? It may be normal, but is it optimal? So now I was saying that when you compare somebody who has, let's say the normal range is 15 million, the normal range is 15 million, your test result is 16 million, but it's normal, right? According to the range. Now, when you compare you, that is 16 million, and somebody who has 60 million, who has a higher probability and chance at fertility? I'll wait for that answer. If you want me to go back again, I can go back again, because if you miss me here, you miss too much. The rest thing I will say will just be confusing, right? So if you want me to go back, let me hear you. We'll go back. Okay, I'll go back again. Now, I'm talking about, remember the whole gist from the beginning has been semen analysis, semen results being normal. That is the whole gist. Now, I'm talking about what borderline normal means. Borderline will mean, when you are climbing somebody's fence, you sit on the fence. You are not inside the compound and you are not outside on the other side. So that's what borderline is, right? Now, with respect to sperm concentration, if the normal range is 15 million, right? The lower limit, that anything below 15 million is abnormal, it's not normal, right? So that's the normal range. Then your test is showing that you are 16 million, right? This 15 million, this 16 million. By reason of the range, you are actually normal. Your result is normal. But now I'm asking, right? When you compare that person with 16 million and somebody who has sperm concentration of 16 million, who has a better chance at reproduction? That's what I'm talking about. Who has a better chance? So that question will help you catch what I'm trying to say. Who has a better chance? Those who said repeat. I've repeated. So I want to know who has a better chance. The guy with 16 million. Right? The guy with 16 million. Yeah. Now, the same thing also we apply when we are talking about motility. Motility, the ability for sperm to move and move forward. Right? So when you have somebody's result which is just barely above the normal range, or what about the morphology, the shape of the sperm cells, and the person just attain barely the normal range of percentage, right? Yeah, barely all the aspects of the test is barely. It's normal, but it's just barely cutting off, right? Now, the truth of the matter is, when you find that kind of results, it's normal, but it's going to be harder to find to get reproductive success. So what is your caregiver supposed to do? Help you boost it, right? That is a smart thing to do. That is a smart thing to do. Now, the conception per cycle we've talked about several times over and over again. For those who are under 35, right, that conception will occur. If you are under 35 years of age, I mean, that conception will occur in this your cycle is just 20-25% chance, right? And that probability depends on how optimal or functional both sides, the male and the female reproductive organ, or not organ, system, is, how optimal they are, right? So let's say they are healthy, both sides healthy. The probability that this cycle is going to end up in pregnancy is just 20-25%. That is biology, right? So if the sperm parameters are now lower or low normal, do you understand what I mean? Borderline. The range is, the limit is 15, you are just hitting 16. What does that mean? It means it has actually decreased the probability even further, right? Because the guys with a higher number will actually have a better chance. It does not mean that you will not have any chance at all. It's just reducing your chances, right? So if you had a chance, if you were healthy and you had a chance of 20-25% conception per cycle, and now your semen result is just showing borderline, almost there, right? It reduces that probability of 20 to 10. You have to do more boosting. you have lesser chance. So when you understand that, your approach on how you relate with your journey will change, because nature is a probability machine, and it's outside your hand to decide. Right? It's outside your hand to decide. So what do? You give it a robust chance. So if we have a borderline of 15, hit 100 and something. Give it nature a robust chance to decide. So such individuals, such cases is usually considered sub-fertility, basically. Why? Because it's more of reduced efficiency. It's not impossible, but it's just reduced efficiency. So when you are dealing with your provider, you now understand what they are telling you to take that supplement or the other supplement so that it give you a better chance, right? So when they tell you to do something, do it. Don't argue. So now, what does weak, when it comes to semen analysis or weak semen, what does that even mean? What does it really mean? You use the word weak. The word weak in medical space is actually a vague term, right? But in practice, weak usually implies what I just mentioned, the borderline, motility, low-end morphology as in the way the sperm look, right? Then suboptimal total motile sperm count. Some people have high debris in their sperm. In other words, in the simplest possible language, some people have dirty in their sperm. Right? So high debris and mild agglutination. Agglutination means the thing they join themselves, right? It may not be, we may not consider that as a pathology per se, but it may not also give you a robust chance either, right? So you want to think of it like, let's say, a marathon runner who qualifies for the race, but he does not have endurance. Endurance in he don't get stamina to run. He is qualified, but when they say on your mark, set, go, he dey tire quick. So that is what we're talking about. He can run the race, but within the race he will tire quick. So would you give that person? You cannot disqualify him because he qualified, but would you put him in the forefront? No, because he does not have a competitive chance. That's why if your result looks that way, it is weak. So what do? Go and booster your sperm, right? Of course, your doctor will help you, right? Your doctor will help you. So those people who have sperm issues, right? Don't worry, your doctor will help you. Now, there is another layer to the gist, which we started talking about yesterday, and that is the DNA integrity. The DNA integrity. You're not going to miss that one. You're not going to miss that one. Because a man can have normal count. Christy LaBelle is here. Hello, Christy. How are you? Good to see you. A man can have normal sperm count. A man can have normal sperm motility. A man can have normal sperm morphology. Yet, you can have elevated sperm DNA fragmentation. That aspect is not what you see in your regular semen analysis. Oh, no problem. You're welcome anyways. You're welcome. Right? Now, this thing we are saying fragmentation, don't worry if you don't understand, don't worry. Just understand the concept. Just understand that there's something in the DNA that you cannot see. Right? And that thing is associated with low fertilization rates, especially in older men. I keep on saying, when you grow older, especially 40 and above, it takes longer for you to be able to impregnate a woman. Right? You that when you were much younger, according to who made that statement the other day, somebody made a statement that only the cap like this, the woman has become pregnant. And you will argue for Africa. That is not you. Right? But now you're older. You knock. You are not seeing results. What happened to you? What happened? Why? It's because of this DNA fragmentation layer. Right? It causes lower fertilization rates. It amounts to poor embryo development. It increases miscarriage risk. And I tell you, when you have multiple miscarriages, please go for genetic testing. If you have done 3-4 IVFs and it's failing, please go for genetic testing. Otherwise, you will waste your time. The regular result may show okay, but you are still failing. Why? I'm telling you the reason why now. That is the reason. Go for genetic testing and rest. Right? So I just gave you a very big expo. Right? So take advantage of it. Why? You see this DNA thing that you don't see. You don't see it on your normal result. This explains what, we did an episode the other day when we talk about the unexplained infertility. Everything is normal. We've tested the woman. We've tested the man. All the result is turning out right. But why are we still not pregnant? We call it unexplained infertility. And I said, and I'm saying now rather, that for you to be able to explain that unexplained, Go for genetic testing. Stop wasting your time. Go for genetic testing. And you will thank me later. Right? No, they don't usually thank me, but I will thank myself later. Right? Let me clap for myself. There is another invisible enemy apart from DNA fragmentation. There's another invisible enemy. Who's ready to know about this invisible enemy? Oh boy, your journey will change after today. I'm telling you, the way you see sperm from today, you're going to change, right? It's going to change. In fact, if there are men here, you're going to thank me for the things I'm saying today, because if you are healthy, right, your sperm will be so precious that it's not just anybody you want to give, right? Oh, so precious. Is that Aibo? Aibo is here. Hello, Aibo. Good to see you. Is Mr. Tabs here? Let me confirm if he's here. Right? So, men, you don't know that your sperm can be so precious? Can't give it to anybody. Right? So, we've talked about the first thing, DNA fragmentation. Let's talk about the second one. Good evening, Aibo. Good to see you. Where's my takeaway? All right. While you are still sorting that one out, let me talk about oxidative stress. Oxidative stress is an invisible enemy. An invisible enemy. And where does it come from? Where does oxidative stress that harms sperm, where does it come from? I'm going to tell you. Simple things. And if you will just change, the sperm status will change. Right? The first place oxidative stress will come from is in smoking cigar. Right? Smoking. Then it will come from obesity. Right? So what are you supposed to do? Cut down your weight. Obesity. It also will be coming from varicocele. Varicocele is more of a clinical thing, but let me just give you an idea. For men who have gone for ultrasound scan, situation where the blood supply there is too much, so it's causing too much heat. Right? Water is here. Hello, water. How are you? Yeah, varicocele. Then environmental toxin, whether it is EDCs that is in your house, chemicals that are sprayed around your environment. Good evening, water. How are you? Right? Or maybe the ones you're even applying on your skin. All these can amount to oxidative stress. Then poor sleep. Sleep. How can you not want to sleep? Sleep 7 hours, optimum a day for the next 3 months. Your sperm will be so precious. I tell you the truth. After today, we're going to be identifying men that have precious sperm. And if you are married to somebody who has precious sperm, hold them tight. Let all those people outside who go collect them for your hand. Right? So if you can stop smoking, stop alcohol, have adequate sleep, manage your stress, cut down your weight, right? Now, so pressing your phone, sleep there. Ivy is here. You're welcome. If you can do these things, cut off all these things for the next 3 months to 6 months, I guarantee you your sperm will become so precious. So precious. I tell you the truth. Right? So, How do we get precious sperm? 3 months of no smoking, no alcohol, no environmental toxin, stress management, and proper sleep. In 3 months' time, you will have sperm so precious, and you did not pay 1 naira for it. You know why? You know why? The reason is because these things cause oxidative stress, and oxidative stress damage the sperm membrane and sperm DNA. They do. They do. Right? And these are not the things that you do normal semen analysis and you see. No, you will not see it in your normal semen analysis result. That's why you keep on trying and you begin to wonder why, what is happening. Sumi Love is here. Hello, Sumi. Good to see you. Now let me give you your symbol. Lovely Nifechuku. Mwah. You're welcome. All right, where was I? Right, so I was just telling our men how to have precious sperm in 3 months, right? And what did I say? I say cut off oxidative stress by having adequate sleep, cutting down your weight, manage your stress. Nutrition is there, right? Stop smoking and reduce alcohol. Thank you very much. I appreciate you. Ivy, thank you very much. Thank you. Thank you very much. Right? So when oxidative stress goes, 3 months, you have precious sperm. And I said you did not pay for it, right? Your functional performance will go up, right? So I haven't said that because this is leading us somewhere, right? It's leading us to timing and functional competence. Because even with normal sperm numbers, fertilization requires these few things. They are big things, but I'll just try to reduce it for general public to understand. Is that okay? Fertilization requires 3 things from the sperm. One is what we call capacitation. The second one is acrosome, is cap reaction. Then the other one is penetration of the zona pellucidea. So these are big things. But what he's trying to say is that for fertilization to take place, yes, T square edibles here. For fertilization to take place, the sperm has to haven't survived the vagina, the cervix, and the uterine cavity. Haven't survived these things. The sperm now has to change his costume, dress pretty well, look so good as it presents himself to the egg that is just there doing shakara. Right? They always do. They always do. And I always say that is just the way women are. Women behave like eggs. So this function, this ability to change his costume and look presentable to the egg is actually what I'm talking about. Functional and timing competence. Several things happen. But again, some things will affect the ability to change, to present itself acceptable to the egg. Some things will prevent that. And what is that thing? Advanced paternal age. advanced paternal age. It may not cause drop in the sperm count. Instead, what happens is that you see that DNA fragmentation comes with age. You see DNA mutation comes with age. Then epigenetic alteration comes with age. Yeah? A 45 years old man may produce sperm or semen that appears normal, tested normal, but fertility efficiency and miscarriage risk may shift subtly. Why? Because at that age, quality of sperm is key, right? Good evening, Pretty Fit. Pretty Fit is here. Good evening, right? So these are. So what was I saying? So we're talking about. Thank you. So we're talking about. Where was I? I was talking about age, right? The decline of sperm quality with age. That's a good question. Who is this? Pretty Fit. You better hang around when it's time for questions. Come up and ask the question. But if you're not here, we'll let it pass. Is that okay? So I was saying that a 45-year-old man may produce semen that appears normal. Yeah, he can. He will. But the fertility efficiency and miscarriage risk may be high. Why? Because of the things I said earlier about DNA fragmentation, about DNA mutation, about alteration in epigenetics. Right? That is why it was easy for you to impregnate somebody when you were much younger and you were even denying the pregnancy, right? All over the place. Now you have been knocking for 3 years and the pregnancy refuses to come, right? What happened? This is what happened, right? Fragmentation, mutation, alteration in epigenetics. Age affects sperm quality. That is a long story made short. Age affects sperm quality, right? Now, I want us to consider a scenario. Yeah, I'm going to finish quick so that I'll answer 1 or 2 questions before I go. So that me too, I'll go and sleep, so that I can have precious sperm. You understand what I mean? I'm not going to teach you how to have precious sperm and I don't have one. It does not make any sense. Thank you very much, Aibo. Thank you. So let's look at when we should suspect that sperm is normal but weak. Let us see. When should we suspect that sperm is normal but it's weak? So let's consider this scenario, right? Regular intercourse. Yeah. Ovulation is confirmed, right? The tubes are open. Stephen, I may answer that question if I hear it again during the question and answer. But if I don't hear it, I will not answer. 3 months of doing what I'm telling you tonight, I'll guarantee you a precious sperm. So all the men that want precious sperm, do what I say tonight. You'll be amazed. You'll be amazed. You come back and thank me. No, they don't come back, but you come back. All right, where was I? So I was saying that Okay, we are considering a scenario, right? We're considering a scenario where there is regular intercourse, there is confirmed ovulation, there is open tubes, confirmed, right? Ovarian reserve is normal. Semen analysis, just good. Normal. Yet, for the past 12 to 18 months, no pregnancy. Why? This thing I just said now is some people's case. So why? This is where deeper evaluation may be warranted. If you find yourself in this case, go to the next level of testing, advanced testing. If you don't know where to get it, come and ask me, I'll direct you. Right? Ovarian reserve. Right? So, the options that you now have, right? The options that you now have. Now, that's why you have to listen to me carefully. Right? Listen to me carefully. The options that you now have: repeat the semen analysis, go for DNA fragmentation testing, um, lifestyle assessment is important, right? And I just told you the things you need to do that you can revise some of these things. If you were not here, go to YouTube, go and watch my videos. I've said it, right? Also, go for ultrasound scan so that we can evaluate varicose. Varicose is a situation where blood vessels open up and there's too much blood going down there, right? So it can be evaluated with ultrasound, right? And also hormonal profiling. These are the options that you have. And do not tell me that you have 3 baby mamas and you have 5 children before. I don't want to hear that. You know why? Because fertility is dynamic. It's not static. It's not static. It's dynamic. And because men don't have too many things that appears physically for evaluation, that's why we don't evaluate often to know how dynamic this fertility thing is. Yeah. So your 3-year-old child from yesteryears is not a certificate that today you are in optimal potential to have another one. No. Go and get evaluated. Go and get evaluated. Right? So I'm trying to help some people. Don't put yourself in this emotional trap where a normal report will get you thinking that you don't hit jackpot, right? A normal report often will shift your focus entirely to the female partner. That's why in the end, my semen analysis is normal. Then the woman will test and test and test and test, and she's okay. When she's done with this one, say no, let's change another doctor. The woman will test. It keep on normal and normal and normal and normal and normal. Right? A few things that I've said today is the reason. Some people have normal results, but they are just above the borderline. And borderline gives you a lesser probability chance. Right? Age is a factor. Oxidative stress that came from all these things I mentioned today is also a factor. Oh boy, I tell you, both partners deserve equal scrutiny. That's what I'm trying to say. Evaluate both partners. Then when the need be, go to the advanced testing. Especially those of you. You see the reason why I'm supposed to have the village meeting for those that are 35 years and above? Because some of you are just wasting your time. You're just wasting your time. But God will help you. Somebody will advise you correctly one day. All right? Somebody asked me the question, can a weak sperm improve? Can it improve? Right? Can it improve? Yes, the village meeting to carry belle, unfortunately, we have postponed it indefinitely. But we will come back to that another time. Right? So can a weak sperm improve? The answer is yes in many cases. Right? The answer is yes. Because spermatogenesis, that is the production of sperm, is a continuous thing. Remember, it takes 74 days. 74 days for one sperm to be produced. 74 days. So that is 3 months plus, right? Right? 74 days. So if you would modify your lifestyle, right? Just a minute. TikTok is just doing some shenanigans on my screen. All right. So if you adjust, modify your lifestyle over 3 months, I guarantee you some changes may happen. So what are the lifestyle you want to modify to improve your parameters? It's very simple. Weight reduction. Stop smoking. That cement problem you think you have are reversible. Reversible. So would you cut down your weight? Would you stop smoking? Would you reduce alcohol or stop it altogether? But they need agree. So reduce it, right? Treat infection timely. Treat it timely. Your body is not a savings account for saving infection. So treat it timely. Yeah. If for any reason you have some issues like varicocele, your doctor can help you. So what are you going to do with stress? Manage your stress. All these things are the things that are causing suboptimal, or subfertility. Right? And what do? Sleep well, 7 to 8 hours. If you do these things I said for the next 3 months, I guarantee you a precious sperm. Who wants a precious sperm? Is there any man in the building? You want a precious sperm? So, okay, for those who are not trying to conceive, what would you be doing with the precious sperm? I can tell you when you ask. When you ask, I will tell you. Hello, Winex is here, right? I will tell you if you ask me. If you are not trying to conceive, so what am I going to do with precious sperm? I'll tell you if you ask me. But I tell you the truth. If you do these things, 3 months to 6 months, the minimum of 3 months, you are guaranteed to have precious sperm. And I'm using the word precious sperm because good evening, you're welcome, Winex. I'm using that because of the kind of quality that you're going to have. And of course, if you have good quality sperm, you're not going to throw it all over the place. Not everybody is worthy of precious sperm, right? It's not everybody. anyway, that's just by the way. Between ovarian reserve and sperm production, right? Ovarian reserve cannot be changed. You cannot change ovarian reserve. But sperm production quality and quantity is adaptable. You can change. So that's telling you, change your behavior, change your lifestyle, change your nutrition, manage your stress, sleep more. Then in 3 months' time, you have precious sperm. Is that okay? All right. Now, if for any reason you fall within what we call the borderline semen borderline, right? Um, you may still have success in when you are timing your intercourse. You may still have success. Definitely, you still have a chance. But you can also consider IUI, that is intrauterine insemination, right? They can help you with that in your fertility clinic, right? It will improve the odds for you. Why? Because it will bypass the cervix and the vagina from killing a lot of the sperm. Then you get the sperm closer to where it can, right? Or you can consider IVF and ICSI. So whichever one you belong to, take it and use the opportunity now, right? The choices of these options will depend on the female age. How old is your spouse, your female spouse? How old is she? What's the duration of infertility? How long have you been trying? 1 year, 6 months, 2 years, and so on, right? Uh, if you have combined findings, there is issues on both sides, right? That again is a matter. And for some people, there is financial problem. So it will determine whether they want to do the IUI first, then they wait to get some money to do IVF and stuff like that, right? Stephen said how to assess ovarian reserve is AMH now. What else? AMH. Who is this? Mao, go to your doctor. Go to your doctor. It's very important you treat infection, right? So whichever of these options fits you, please use it. Take it and use it. Because if you don't use it, you're going to waste time. And if you waste time, your options are reduced, right? So I think I want to take questions now.